My name is Grace Kiwanuka. I am the Executive Director of Uganda Healthcare Federation. We're an umbrella body for the private health sector. This year we celebrate 15 years of existence. We started out initially as an advocacy body for private health sector interests, but our role and contribution to the health system has grown to include program implementation and hosting events that convene both public and private sector as well as civil society to allow us to showcase what the private sector is doing in the Uganda health system, but also to give an opportunity for dialogue to make sure that we're working synergistically with the Ministry of Health and other departments and agencies of government, as well as in line with the government priorities when it comes to the health system, and making sure that we're implementing initiatives that not only are valuable to the health system at large and the communities, but are in line with national policy. If I can explain what the Federation does. Most of our programming has been around health system strengthening. What we do is we look at initiatives that are tailored for the Uganda health system and make sure that the policies that are being applied in the government sector or the public sector are applied in the private sector. This means that, for example, if you look at one of the key tenets of our country is that, it's constant in our constitution, is that the government of Uganda will provide health services to the population. The private sector in health exists to complement the role of government in providing these services. So you find investors that are part of the UHF membership that are health professionals, health service providers, manufacturers and industrialists in health, but then you also find people that work in technology related to health. And this means that as we work through our membership that encompasses all these different stakeholders, we're able to speak to predominantly all the areas that the government of Uganda is implementing in to see how we can complement. And as you know, in Uganda, we have a mixed health system, but that spreads all the way through to service provision, not only just in service provision, but it spreads also in the development of health workers. So you'll find a lot of health training institutions are privately owned. And what we do is when students come out of these health training institutions, we see what we can do when they're in the workplace to make them fit for purpose to meet the demands of the government policies in terms of service delivery. So what does that mean? It means that we do a lot of policy training and guidelines and standard operating procedures training and capacity building. We also make sure that these policies guidelines speak to the private sector setting, so that if you look at the structure of the government facilities, you'll have a VHT who's working at the community level. Then you have health center 2, 3, 4, and then you have general hospitals and referral and regional hospitals and the bigger tertiary hospitals. The private sector doesn't really mirror this. We tend to have small specialized units which maybe have 1 or 2 people, but the capacity of the health worker is that they can actually operate on a patient, much as the infrastructure of their facilities and able to accommodate that service. So what we do is we're trying to work with the Ministry of Health right now to make sure that the private sector is appropriately classified so that we're able to have a better picture of what the capacity is in the country when it comes to specialist services. One of the challenges we have as a country is we have a heavy reliance on international health services, what we normally know as medical tourism. And this has grown a lot in the region. Even countries like Ethiopia, Kenya, which is more popularly known, is where people tend to go for services that they believe are not available in the country. Unfortunately, it's a matter of communication because a number of the services they're going to Kenya for are actually already available in the country at a very high standard. We have expanded the scale and scope of services in the private sector to speak to the demands of our population when it comes to non-communicable diseases, which is a growing trend in our community. We've also made sure that the services don't only have the expertise, but they also have the infrastructure and the specialist equipment that you need. So we've seen a big growth in importing of specialist equipment that allows our health professionals to be able to provide these services safely and in a very high standard locally. That reflects the nature of the private sector, as we tend to be more clustered in the urban setting. So if you want to look at equitable health, you'll find that in the rural setting, you'll find more government facilities, you'll find private not-for-profit facilities that belong to the medical bureaus. And in the urban centers, which would be the cities and municipalities, is where you'll find more private providers. oftentimes the conversation revolves around private providers are focused more on profit rather than the care of the patient, which is possibly could be viewed as quite unfair on the investors in health, because foregoing putting up apartments or going into trading vehicles, they've decided to put up facilities, make sure they've bought equipment, providing employment, and it's not just the health worker themselves, they're providing employment to support staff. All of this requires them to make sure that they pursue revenue to be able to meet operating costs. So oftentimes we have to unpack that for audiences to say the private sector is not solely profit driven. It's actually purposefully seeking to make sure that they provide a wide range of services at a standard. And a lot of people visit private providers because of the experience. They're looking at the furniture, they're looking at the decorations in the facility, as well as the qualifications of the health professional. So when you're seeking services in a private facility, all of that has to be factored into the investment case for that provider to make sure that they're providing a service and an experience that will make the health consumer want to come back for services. You have to make sure that patients are seen in time and that you see them at a standard where you don't have what we call repeat visits. So all of that is part of the investment that health providers make. And at times, the conversation around equity and making sure that affordability of services on our side as the private providers and the umbrella body for the private health sector, we view it as the responsibility of government to provide services, free services at that, is at times also seen as a misnomer, because health services simply cannot be free. We have a bulging population, and we also have limited resources when it comes to tax revenue. The tax base isn't expanding as fast as our population is expanding, and that in itself stresses the revenue available to government to invest in health services. So the private sector comes in to complement the role of the government when it comes to health services, and by coming in to complement the role of government in the provision of health services, the private sector not only decongests a number of public facilities, but right now we're in a process of seeing how can we share the burden? How do we make sure that the private sector knows the standards and the guidelines that are required of them to be able to meet the requirements and compliance with national policy, such as avoiding smoking. How do I look at other sectors? How do road users behave? We've seen a recent drive to make sure that people drive more safely. I think there have been a number of penalties that have been introduced for speeding, for example, when you're near schools or hospitals or other urban roads. This is all part of the multi-sectoral approach to making sure that communities understand their responsibility when it comes to their health and living longer. So it's not necessarily just looking at what happens in a health facility. It's looking at what happens in your home, what happens in your community, and what can you do as an individual. For those who take border borders, for example, border borders have become a necessary mechanism for transportation because of the limited public transportation we have as a country. However, as an individual, when you're in a border, are you the person telling them to drive down the wrong side of the street? Are you the one telling them to jump a red light, for example? Because that endangers you. When you have a spinal injury and you're not able to walk again, then you have that challenge. You and the border rider may just stand up and walk away. So the responsibility isn't necessarily just on the Ministry of Health or on government. It's actually on us as individuals to take responsibility for our health, to take responsibility of our behavior, and to take responsibility for those around us to make sure that they're not risking our lives through what they do on a day-to-day. That the fact is that Uganda needs to become more reliant on itself. And I think the journey to self-reliance was a catchphrase for one of the partners for quite some time. And one of the things that we are looking at as a country is there's already been adaptation. The conversation around independence of Uganda's health system from donor funding has been a conversation that's been there for a while in the Ministry of Health. And it's something that the ministry has been looking at, and we've been discussing it through what we call the Public-Private Partnerships in Health Technical Working Group, amongst other fora within the Ministry of Health. So the conversation isn't new. I think what the surprise was the abrupt nature of the communication that the aid cuts the aid cut is taking place effective this particular month. And I think it was more the surprise that was taking people aback rather than the decision to reduce aid. Fortunately, as a country, we are pretty good at adapting. I think that has been reflected in our responses to a number of outbreaks and a number of health emergencies that have been occurring in Uganda for a number of decades. So that shouldn't really be a concern. What would be more of a concern is, are the solutions that we're implementing sustainable, and are those solutions that we can contribute to as the private sector? So one of the things we're also fortunate in the country is that the private sector, both health and non-health, have already been implementing a number of initiatives that complement the investments in health from the development partners. So now it's a shift from international partners to focusing more on local partners. And like I said, this is not a new initiative. It's something that we've been working on for a number of years. And as a country, we're now looking at which areas should we prioritize is now the conversation. Maternal child health is an area that we're looking at to prioritize because that is an ongoing challenge to build the capacity of the private sector to be more responsive in terms of providing quality and timely interventions for mothers, communicating to these young mothers when they're expecting, not only to access family planning commodities when they need them postpartum after delivery, but also to make sure that they ask about them when they're in the facilities. What we're also doing is looking at how do we make sure that public sector partners more meaningfully with the private sector? And this is a conversation, like I said, that can only be properly translated through public-private partnerships in health. We have a number of examples from across the region, internationally, even beyond the African continent, where we have different private sector players coming in to be contracted by the government to be managing different areas that were previously managed by government, but being contracted for the same resources to be managed by the private sector. So there are different models that we can use as a country, and I think that is the direction that Ministry of Health is exploring to see how can we make the minimal resources that we have available go further to be able to prevent more illnesses, to promote more health, so we can get more health for the money. We recently wrapped up a health financing dialogue that really unpacked clearly that the private sector has a big role to play, and not just the private health sector, but the non-health private sector. Our challenge is fragmentation and not talking to each other, and everybody wanting to work in a silo. So now what we're trying to do as the Federation is break down these silos, bring all the money together so that it can do more. So as a country, as was discussed in that health financing dialogue, we can actually get more money for health and more health for the money that we have. Expo, in partnership with COPIUS and the Ministry of Health, has been a good nexus for us to bring this out. So between the 1st and the 3rd of August, we will be hosting a Family Health Expo at the Showgrounds, and we're excited to see both stakeholders in the health sector and those outside the health sector, because health is a multi-sectoral issue. There'll be an opportunity to see exhibitions, there'll be an opportunity to have health checks, but also to contribute to a dialogue and a conversation with high-level speakers and stakeholders who are going to come to speak about what is Uganda doing to respond to health threats that we anticipate are going to be increasing, but also what you can do at a community level and what you can do as an individual in your home to manage your health, because your health remains your responsibility.